Hey you guys, welcome to the first installment of Ask Alex RDH, a series led by you, the viewer, where I answer the questions that you guys have left in the comments. Let's get into it. Raystar2099 asks, Alex, is it true that Oral-B gets really dirty and lots of mold on the body and the head even when cleaned? Raystar, great question. It is possible to get mold buildup on your toothbrush. Usually it builds up right around the motor attachment and sometimes around the actual opening of the head. It has small little slots so things can often drip down in there. So if you do see it gunky, what I like to do is rinse it out with water, and for the really hard spots you can even use your toothbrush or a towel to really wipe it clean. Before I store my toothbrush, I will often make sure it's really dry and has no moisture before storing it, because that could result in some mold. Marie asks, aspiring to be a pediatric dentist but also considering becoming a dental hygienist. I'd love to know some tips about becoming an RDH and if it's a rewarding path. I'd also like to know how competitive it is and if it's better to choose RDH or dentistry due to dental schools being highly competitive. Marie, both dentistry and dental hygiene are highly rewarding fields. You get to help people, very satisfying, and the pay is actually quite good. Both dental hygiene and dental school can be pretty competitive to get into. The school I went to accepted 25 students per year, usually about 200 applicants. Dental school can be even more competitive, but if you have good grades and you're really on top of your GPA, you should have no problem. A dental hygienist is a mid-level provider, whereas a dentist, they have full scope of practice, and a pediatric dentist, they specialize in pediatrics. I've worked in pediatric dentistry and I've worked in general dentistry for many years, both general and pediatrics, very rewarding. Pediatrics is especially great if you're good with kids. The biggest difference between dental hygiene school and dental school is that dental school is quite a significant amount more expensive, usually in hundreds of thousands. They also make a lot more money coming out of school, so it does even out. My recommendation for anybody interested in anything in the dental field is call the office where you go to get your cleanings and see if they will allow you to do a job shadow opportunity. It can be a whole day, it can be just a couple hours. Just follow the dentist or dental hygienist around and see if you would enjoy doing what they do on a daily basis. Good luck with your studies and let me know if you have any more questions. AC Unit 55 asks, are you AI? Uh-oh, I've been found out. Just kidding. No, I'm not AI. Or am I? Daisy asks, I am worried that the IO series brush heads might be a little too hard and cause gum recession. Have you tested which electric toothbrush works best? Also, which dental floss do you like most? Do you have any recommendations? And toothpaste. Looking forward to your reply. Daisy, thank you so much for your comment. Research has shown time and time again that an electric toothbrush, if used properly, will not cause any gum recession. So if you're using the correct technique and going really slow and letting the toothbrush do the work, the chances of recession are slim to none. I've tested both the Sonicare and the Oral-B toothbrushes. I have to say, I've used the Sonicare for longer, but recently switching to the Oral-B IO, I like it a lot better. It just makes my teeth feel a lot cleaner. As far as floss, there's many great brands, but here are my favorites. Just for your everyday use, Reach is awesome, Cocoa Floss, Radius Floss, Dr. Tongue's Floss, Boca Floss, they work great. As far as toothpaste recommendations, I love Arm & Hammer, and if you're looking for something a little more natural without fluoride, David's hydroxyapatite toothpaste is great. Sabir asks, what are types of flossing materials / instruments? Sabir, another great question. Hardly anybody likes flossing, but there are a lot more tools to clean between the teeth. So when a client tells me that they don't floss, I actually don't get very angry. Flossing is hard. There's many other tools that you can use between the teeth. You can use a water pick, you can use a toothpick, a floss pick, an inner dental brush, soft pick. There's so many products out there on the market. The goal is to clean the plaque between the teeth, not let it sit there for a long time. Anything that you're using, I'll be a happy camper. Do a video on mouthbiome, the effect of alcohol mouthwash on it, and nitric oxide. This is a huge topic, and sometimes your general dentist doesn't even know about nitric oxide. In the future, I will do a video on this subject because it is so deep. In short, our mouth is the gateway to our body. If we use an alcohol-based mouthwash, it can actually dry out the mouth and cause a disruption in the oral biome. That's why I recommend avoiding alcohol-based peroxide-based mouthwashes. Nitric oxide is something that's created by our paranasal sinuses. It helps dilate blood vessels, improve circulation, and support our immune system. If you find yourself constantly breathing through your mouth, you're bypassing all the filtration system that our nose has to offer, and therefore not producing as much nitric oxide. That has a slew of bad effects on your overall health, not only in your mouth, but in the rest of your body. YouTube Willie Man asks, what are your thoughts on hydrogen peroxide-based mouthwashes? Willie Man, great question. Hydrogen peroxide is very effective at killing bacteria. A lot of people make the claim that it can whiten teeth, and yes, hydrogen peroxide can whiten the teeth. However, you gotta think about contact time. When we're rinsing our mouth, typically we only swish for about 30 seconds to a minute. That is not enough contact time with your teeth to really cause any significant whitening. Can it whiten? Yes, but to a degree. In 2020, during the pandemic, most dental offices use hydrogen peroxide as a pre-procedural rinse before dental procedures because it is very effective at killing bacteria and viruses. The problem is overusing it. If you use hydrogen peroxide too much, it can actually cause black hairy tongue. Not only that, but it can irritate your soft tissues. I usually recommend a 3% hydrogen peroxide diluted with water and not used more than 2 or 3 days a week. Sabir147 asks, why electric toothbrushes? Can't we do better with normal ones? Sabir, yes, manual toothbrushes are great and you can do a great job with a manual toothbrush. However, research shows that electric toothbrushes, when compared to manual toothbrushes, are far more effective at cleaning and removing the plaque. You have to remember, an electric toothbrush moves a couple thousand times per minute. No human can do that with their hands. So when you're comparing the effectiveness of an electric versus a manual toothbrush, an electric one will always win, just based on speed and efficiency alone. DF29208 asks, I love floss sticks. What is your opinion? Do a video. Floss picks are great. I use them all the time, especially if I'm in a time crunch. I keep my floss picks in the car, keep them in the lunchbox. Anytime I can and I have something between the teeth, I like to floss. They're great because you can use them with one hand. They don't require a lot of dexterity. A common problem I see people doing with floss picks is using them way too fast. You want to take some time and make sure you're going between all the teeth and as far as you can get. It's not 100% perfect because you won't be able to reach all the spaces, but it's better than not cleaning between your teeth at all. Karina asks, just curious, why do vitals need to be taken during dental appointments? Karina, great question. I get this a lot. People are always confused why I'm taking their blood pressure and pulse at a dental visit. Research shows that people come into the dental office more often than they come into the medical office. If you're fortunate enough or unfortunate, depending on how you look at it, most people come into the dental office 2 or 4 times a year. The average medical visit, people come in once a year and sometimes even less frequently than that. That is why it's important for your dental professional to screen you for high blood pressure or tachycardia. In dentistry, we use local anesthetics to numb you and make sure you're not in pain. So if you have a high blood pressure and we give you medicine with epinephrine, that could result in a not so good scenario. Fotinos Q7F asks, do you think fluoride anti-cavity mouthwashes are good? In particular, the TheraBreath anti-cavity mouthwash, which contains fluoride. Another great question. TheraBreath is a great mouthwash because it has a pH balanced formula and it does not contain any alcohol that'll dry out the mouth. Fluoride is a great additive into mouth rinse, especially if you're more prone to dental decay or cavities. Maxsoul783 asks, bro, can you please make a tutorial on how to gargle properly? My son can't do it. Maxsoul, it can be really frustrating teaching a kid how to do something, especially something complex like gargling. I would start by introducing your son to swishing and just doing it with some water, swishing it around. Once he gets that task down, then you can add the extra motion of tipping your chin up and making a gargling sound to start the process of gargling. Don't get frustrated if your son doesn't get it on the first couple goes. It's a hard thing for kids to do, and actually not 100% required. Take your time and do it with him. Make it fun. He'll get it eventually. Thank you guys so much for watching. I'm sorry I wasn't able to answer all the questions. If you're itching for more dental knowledge, drop your questions down below. I'll make sure to respond. And I hope you're excited for the next round of Ask Alex RDH. Stay blessed and refreshed, defend what matters daily, and let the healing begin.